Winona, this is the lovely Minister of Mental Health and Addiction.
Hi, it's very nice to meet you.
So what are you working on?
I'm just doing stats right now for for all the folks that come in and what services we get. So I've got some stellar music to make it less
I
torture.
love it. I love it. Okay, well, we won't keep you too much from... We have a really, really awesome space in here in terms of storage. So where are your supplies sourced from? So that would be a really amazing Sarah question.
Okay.
So we get our harm reduction supplies from the Symptom Scope District Health Unit, and they get it through the Ontario Harm Reduction Distribution Network.
So we do our best to receive donations in whatever capacity that we can to be able to stock things, ensure that we can give high protein items, right? Recognizing that that's something that a lot of our folks lack. So as much as we can get tuna and peanut butter and all of the cheese, those things are really important. Yeah. And so we do our best to source it, but unfortunately funds are limited, right? And so I'm in the process of trying to build partnerships with different organizations and different businesses to see if maybe there can be some collaboration happening. Okay. This family and youth space is used in the best ways possible with youth. You see them come in, you see this like sense of community. They have Dungeons and Dragons nights. They do we do all sorts of really fun stuff here. We also have a dedicated staff on the team specifically that works with the school boards in the local area to talk about what queer inclusion looks like, impacts on mental health, all of those different pieces. And
On a weekly basis, how many folks
so
humans are coming through here?
On our Discord server, we have almost 300 youth.
Wow.
Accessing in person varies depending on which community we're in, because we also go to Bradford, Stayner, Aurelia.
Okay.
And so in those spaces, we normally have an average of 6 to 12 humans showing up in person, but that has been increasing as the pandemic is getting further and further in our past. And there's a big call for more in-person programming from youth. So we're hoping
do you see your numbers going up, not just in terms of the return to in-person from COVID, but just in general of interest and participation?
Absolutely.
Let's say pre-COVID to now?
Yes, absolutely. And also during Pride Month, it was really exceptionally high and great because it got a lot more people enrolled that didn't know about us.
Sure.
So we went and did tabling at some of the smaller community events that were having Pride things. So this is our clinic. So we have another entrance here so folks can come directly through a more confidential entrance at the local hospital. So with RVH, they're going to be providing some assistance to us through their lower limb prevention program.
Okay.
And so they're going to be coming on a weekly basis for a full day to be able to provide foot care.
Oh, nice.
This here is our actual clinic room. And so we provide sexual health services and testing on Wednesdays, but this is now going to be utilized by other community partners, and we're bringing other folks in. We'll be doing point of care testing every Tuesday in the harm reduction space, so bringing folks back, getting people really involved in their care, learning the different pieces. We have doctors and nurse practitioners that come in on Wednesday nights. Earlier today, an individual was just released from the federal penitentiary near here, HIV positive, newly acquired. The jail said, go to the Gilbert Centre. They showed up here. Randy was able to meet with them, get them an appointment for next week or the week after, and then we were also able to then walk them down the hall to John Howard and help them access those additional services. Right. So we kind of are a one-stop shop when it comes to stuff like that.
Yeah. I was in BC recently, and some of the conversations we were having with the outreach teams on, we're constantly evaluating the decrim process there of like the point of contact with the referral cards. Like, it's not ideal.
Yeah.
It's not ideal. It's not this. It's not that. That's why the outreach piece, the human, I see you.
Yes.